Hello everyone, welcome back to my channel. If you're new here, hi, my name is Charlotte, I'm a registered nurse, and today I'm so excited because I'm going to be helping you prepare for the nerve-wracking and incredibly exciting step in the ACE application process, which are the job interviews for your first ever nursing job. If you haven't seen the first video in my little mini-series all about ACE and NETP, then I highly recommend that you go and check that out before watching this, just so that you're all up to date and you know exactly what we're doing. But if you've already started the application process and you have gotten a job interview offer and you're ready to start preparing, then this video is for you. Before we get into everything, don't forget to like, subscribe, do all of that good stuff, but for now, let's dive right in. So for me personally, I got 4 job interview offers through ACE. The first one went okay, but when I compare it with my other interviews, it was really bad, a complete train wreck. But I did learn from it, and I went on to the other job interviews with these lessons in mind, and those job interviews were so much better. I was more relaxed and I came across as more confident and friendly, so it worked out in the end. So I'm going to be sharing with you everything that I learned and my advice from how to prepare for interview questions all the way to the night before and the day of the interview, what you should do. So let's start by preparing for possible questions. In Aotearoa, we have Te Tiriti o Waitangi, which is our founding document pretty much. This and cultural safety are a huge part of nursing care in New Zealand. So you should expect to get 1 or 2 questions about Te Tiriti o Waitangi and cultural safety. So they could be anything like, how do you uphold the principles of Te Tiriti o Waitangi in your nursing practice? Or they could ask you about some Māori health models like Te Whare Tapa Whā. I got asked about that in my nursing interview. Or they could ask you about some Māori values and how you think they link with your nursing practice, or how you can demonstrate, or a time that you've demonstrated these values. If you don't understand a word, or you don't quite understand the question that they're asking you, you can ask them to repeat or rephrase the question. That won't mark you down or anything. And then once you've done this, just take a deep breath and think about how you're going to answer the question. This is why we want to prepare for our interviews, just so that we're in the best position possible and we're not going to get caught off guard by much. So Te Tiriti o Waitangi and cultural safety will definitely come up in your interview. Another type of question that they can ask you is a what would you do question. For example, you are doing vital sign rounds in the hospital ward and you notice that a patient is unresponsive. What would you do? When I was doing my district nursing interview, I got asked a wound-based question, and this was a client comes to your clinic and they have a skin tear which is malodorous, red, inflamed, and is causing pain to the patient. What would you do? And I bring this up because the question, the what would you do question, was linked specifically to the role that I was applying for. The main part of district nursing is wound dressings and wound management, which is why they asked a what would you do question that linked with wounds. So think about the role that you have applied for and that you're interviewing for, and think about what kind of what would you do questions they could ask you. So for example, with pediatric roles, you'll want to brush up on anaphylaxis and respiratory distress. Mental health, you'll want to go over conflict management and de-escalation practices, and so forth and so forth. So you'll want to have a think about role-specific what would you do questions, but you will also want to think about general nursing what would you do questions. So things like patient confidentiality and consent are big ones, because you could get a question like a family member or a friend of a patient has called you over the phone and requests an update on the patient. What would you do? Also medication safety, because you could get questions such as a patient has medications that they're meant to take in the morning and they have told you that they have forgotten whether they took it or not. What would you do? So just remember to prepare for specific role-based questions as well as general nursing principle questions. The next group of questions they could ask you are questions designed to suss out how you work. So they will ask you questions like, do you work well as a team, and can you give us an example of one time that you worked well in a team? Or how do you feel about leadership, and can you give us an example of a time that you assumed a leadership role? In 2 out of the 3 interviews that I did, I got asked about how I would deal with a colleague who I was having a misunderstanding or conflict with. They could also ask you questions about how you deal with angry or aggressive patients or customers, and if you've come across something that you've never seen before, you're confused, what's your plan of action for that? So they can ask you these questions, especially in terms of give us an example of a time when you ... have a think about times during your nursing placements or even during your part-time job or in your daily life where you have either had to work in a team or shown leadership or had to manage conflict. Just have a think so that when they ask you these questions, you already know what you're going to say as an example and it will just flow off your tongue. They can also ask you what you would do differently in these situations. So just have a think about whether you feel like how you react in that situation you're given an example of is the right thing to do, and if you feel like you could have done something else, then you can also bring that up with the interviewers. The last one that I can think of about the types of questions that they'll ask you will be questions about your character. So for example, they can ask you, and I was asked, about your strengths and weaknesses. So you'll give them, oh, I think I'm really compassionate, I'm really organized, give them your strengths, and then when you get to the weaknesses part, you want to turn it into a positive. So for me, I said that I think one of my weaknesses is that I'm a little bit quiet and it can come across as me being shy or timid. However, I also think that this can be a strength because it means that patients and their families feel like I'm really listening to them, and it makes them feel comfortable when they are explaining things to me. So when you get a strengths or weaknesses question, for the weakness section, you want to turn it into a positive, and then this way the interviewers will walk away knowing that you are self-reflective, you are self-aware, you know what your weaknesses are, but also maybe that weakness isn't such a weakness after all, and so they leave feeling really positively about you. So just have a think about what your strengths and weaknesses are and a way that you can turn your weakness into a strength. So these are all of the types of interview questions that I can think of that they might ask you. Just remember that you will get a couple of curveball questions which you are unprepared for and you won't expect. That's okay, that's going to happen in your interview. You just have to take a deep breath. You can stall a little by saying to the interviewer, that's a really good question, and then just take a minute or two just to kind of think about how you want to answer the question. In the interviews, even though you feel stressed and pressured, you have a lot of time. This is your interview, so if you need a minute just to think about how you're going to answer the question, that is okay. It's better to think about it and have a good answer than to rush into it and sound really confused and not making sense and stuff. So take the time, just take a deep breath, thank them for the question, it's a really good question, and then just take a minute to think about what you want to say. So a top tip is that interviewers, especially for the nursing job, they want to assess whether you are safe. So if you come across a question that you don't know how to answer or you haven't prepared for, the first thing that you need to think about is how can I keep the patient the safest, if that's relevant to the question, because the main thing and main priority for the interviewer is that they're going to be hiring you into a role in which the main goal is patient safety. So patient safety is always first. If it's a strength or weaknesses question that it doesn't really apply to, then just take a minute, just take a breath and have a think through. Here are my top 3 things that you should be doing the night before your interview. They're a little bit basic, but they are very important because it will set you up the next day for a good day and a good interview. So the first one that I recommend that you do is to get a good night's sleep, because you don't want to be waking up tired and with a bit of brain fog. You want to be going into your interview nice and refreshed. And on my first interview of the district nursing, I had stayed up the night before to make the district nurses for my placement biscuits as a thank you present, and I had also taken my sister into hospital the night before as well. So I was very, very tired and a bit sleep deprived, and my first interview didn't go very well, whereas the second interview I did at the GP centre did go very well, and that was because I was refreshed and I had a full 8 hours sleep, and it really does make all the difference when you feel more alert. So try and go to bed a bit earlier than you would normally and just let yourself have that rest. The other thing that you need to to do is make sure that your alarm is set so that you are on time and you're not going to be late for your interview, because even if it's not part of the interview, it technically is. The interviewers will be assessing how punctual you are, how organised, and if you're late, they will look at that as a sign that you may not be as good as an employee as some of the other students that they will be interviewing who arrive on time. So make sure that your alarm is set so that you wake up on time and so that you're leaving home on time as well. The last thing I would recommend doing the night before is to try and do something fun or relaxing to take your mind off it. I wouldn't really be prepping for any interview questions or prepping for the interview the night before, because at this stage you've done everything that you can do. So just take the breath, take the rest, make sure your alarms are set, and try and do something relaxing or fun just to make sure that you're not stressing about it. So it is finally the day of the interview, the big day. What should you be doing? So my first tip is to make sure that you dress professionally or tidy. Something like this is really nice. It's a cute little blouse. It looks tidy. It's not too casual, but it's also not over the top. You can wear, if you're into dresses, a nice professional dress works really, really well. For my interview, I wore a dress and some tights, and I had boots and my jacket, and that looked really nice. I did my makeup and I did my hair, and I just made sure that I had presented myself to my best standard. You don't have to go all over with, makeup and stuff, but just making sure that you look tidy and clean is the most important thing. So you can take one last look over the prepared interview questions just so that you feel confident and that you've gone over everything and that you won't get caught off guard by anything. If you start to feel nervous, then one thing that you can do is focus on your breathing, which I know sounds really basic, but it really did help me through my interviews, especially before when I was waiting, because all of that anticipation, it can really get to your nerves a little bit. So if you're in a situation where you're starting to feel nervous, focus on your breathing. A really good breathing exercise to do is box breathing. So you inhale for 4 to 5 seconds, you hold your breath for 4 to 5 seconds, you exhale for 4 to 5 seconds, and you hold your breath for 4 to 5 seconds. So it's like a box almost. And this is really good because you actually have to focus on what your breathing is doing, and it helps take your mind off of this stressful situation. In the interview, if they offer you water, then I would definitely accept it, because if you're feeling nervous especially, one of the things that can happen is that your mouth can go dry. That's what happened with me, so it was really nice to have a glass of water just so that I can, take a moment and calm myself down a little bit. And it's also really good to have, because if they ask you a question and you're not too sure how to answer it, you can take a sip of water. It kind of gives you a couple of extra seconds to think about what you're going to say. So it can be really, really difficult to manage your body language when you're feeling stressed, but the best thing that you can do, because you want to appear friendly and welcoming, is smile and try and make sure that your body language is nice and relaxed. When I went in for my interview, the first one, I was so stressed, and it was really, really obvious because I was all tensed up and really, really rigid. So if you can let yourself take a nice deep breath when you go and sit down, and then you can just relax. If you lean back in the chair, it shows that you are relaxed and stuff. Keeping your shoulders nice and open, having a nice friendly smile are all really good ways to impress the interviewers and show them that you are relaxed and feeling confident about the interview. Another thing that can also be really difficult to manage, especially when you're stressed, is your voice. So you want to be loud enough that the interviewers can hear you, and you don't want your tone to sound timid because you want to come across as confident. To do this, and my second and third interview, that really worked for me, but I pretended that I was speaking to a friend or a colleague. So when they were asking me questions, I just pretended that the interviewer was either my friend who was asking or a colleague who was asking for help, and I had to explain it to them, and that made me feel a lot better about answering the questions, and it really altered the way that I spoke, because in my first interview I was so stressed that my voice went all quiet and soft-spoken, and it made me seem really, really shy and timid and didn't come across as confident. So just watch out for your body language and your voice. Before the interview finishes, they will always ask you if you have any questions for them. So I would recommend coming up with 1 or 2, but never more than 2. 1 or 2 questions for you to ask them. You can ask them about the company, you can ask them about the nursing role that you're applying for. Just ask them 1 or 2 questions to show that you're interested in the company and that you have prepared and are organised organised because you have these questions available. Once the interview is done, I would thank them for their time, and if they've given you water, I would ask what they want you to do with the water glass, because this shows them that you're thoughtful and considerate. It's not the most necessary thing in the world, but it's just a nice little extra thing to do, little cherry on top. When you get home, have something to eat, have a drink of water, and take a couple of deep breaths. Kind of reflect about how you're feeling about the interview, and then just move on, because you have done everything that you possibly can, and now you will either be preparing for your next interview or you will be waiting for the ACE job offers to come out in your email. So at this stage, there's nothing else that you can do. You have done your best. Congratulations. It's time just to relax or start preparing for the next interview. So those are all of my interview tips coming from somebody who had one really bad ACE interview and then a couple of really good and successful ACE interviews. So I really hope that you found it helpful. If you have gone through the ACE application process and done the job interviews, or you've done job interviews for other nursing jobs, please leave your advice and tips in the comments, because sharing is caring and we want to lift each other up on our nursing journeys. I will link the ACE website in the description box so that you can go through it at your own leisure. Before you go, don't forget to like, subscribe, do all of that good stuff. I will see you next Monday with a new video, but until then, have a lovely day and a fabulous week. Bye!
It's rated X. That means you're extra.